TV.square.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the Better Hair, Better You show with Dr. Sierra, where the Robotic Hair Institute in Fort Lauderdale, Florida is a premier robotic hair restoration clinic. Dr. Sierra treats men and women of all ages who long to return to the days when they had copious amounts of hair. From implants to toupees to various chemical applications, men and women are eager to embrace a variety of treatments that promise to restore hair to its youthful volume and abundance. This show will discuss the latest procedures and technology for hair restoration. We specialize in providing the latest no-scar, robotic view hair restoration surgery. And thanks to advances in medical science and technology, we also offer non-surgical procedures and medical protocols combined with proprietary topical compounds to help augment and solidify results. Get ready to call in at 888-565-1470 and join the conversation of this amazing procedure. Let's start improving our lives.
You can have red,
Yeah,
you can have blue,
you can have a rainbow if you really want to.
you can cover it with glitter if you don't mind the mess.
You can even shave it off if your mom says yes.
I'm crazy headed, you can wear your hair to style. I'm crazy headed, you can wear your hair to wild.
Hello, and I can't even get through this with this crazy song. Welcome to Better Hair, Better You. And whether you are having a good day or bad day when it comes to your hair, hopefully this cold weather is helping your static stay down.
Yeah.
I'm your host, Alana Shear, joined with none other than Dr. Rafael Sierra with the Sierra Robotic Hair Institute located in Fort Lauderdale, Florida. Hi, Dr. Sierra.
Hi, Elena.
What did
How's
you
your
think
crazy
about
hair today?
My hair's been holding okay. What did you think of our little surprise opener today?
Well, at least some people have some hair, right?
It reminds me of all kind of crazy, wacky hairstyles and hairdo trends we've seen throughout the ages. But I think those that we just saw today are a little more abstract than usual.
Yeah, a little more artistic, maybe.
Yeah, it's going into the arts, I would say. As always, during our show, if you have any questions for Dr. Rafael Sierra and what he does at the Robotic Hair Institute, you can give us a call at any time at 888-565-1470. Again, that's 888-565-1470. And whether you're tuning in from WWNN's 95.3, 96.9, 1470, or catching our live stream, we're happy to have you here. So last week we played a little game of myth busting as far as hair, and that has led in lots of questions today.
Oh, wow. More myths?
Yes, no more myth busting. We'll have to save that for another time, but lots more questions.
Okay.
But before we get started, I wanted to jump in with a little more questions because someone wants to know if you can explain what the difference is between FUE and FUT.
Sure.
I know that you specialize in the FUE system. We talk about it all the time, but could you clarify the difference in what you offer?
Sure. So FUT stands for follicular unit transplant, and that's a fancy name for also what is known as a strip method. In that technique, what we do is, or we used to do, is to remove the donor area, from the donor area, a strip of skin. And from that strip of skin, we would obtain the hair follicles. Then we obviously have to bring back together the skin edges. The downside on that technique is that after the surgery, there is a scar that goes across the back of the head. And also, it is something that a technique that is it's definitely more painful and also a higher risk of complications. FUE, which is the newest technique, and this is what we do at the Robotic Hair Institute, that instead of removing a strip of skin, we take every hair follicle at a time, one at a time, directly from the scalp, from the donor area. And the end result is that we have the same amount of hair follicles, but without a scar, without a visible scar. And obviously the recovery is a lot faster. People can go back to their lives within 24 to 48 hours. The risk of complications is a lot less, and the results are more natural. Again, there is really no scar
So
that,
more
that can be
natural,
seen.
less invasive, less risk.
Yes.
And the cool part about it is that you are the Robotic Hair Institute. So when we're talking about this, strategy of individual hair follicles, the unit extraction individual, you're not even talking about using robots to make sure that precision is right on point, correct?
That's correct. Yeah. The great thing about the robot is that it gives us the best quality grafts that we want, that we need. Because the quality of the graft is it will determine how successful the transplant is. So with a robot, just like you said, it's very, very precise. It will give us grafts that are better consistently. If you can imagine doing something 100 times repeatedly with your hand, you get tired, you start missing.
Yeah.
The robot doesn't get tired, and it's always precise and programmed to get us those hair follicles.
It's pretty neat to think what technology can do today as far as helping people and bringing them into the operation room and into surgeries and
Yeah.
to procedures like this to help people. Now, you mentioned FUT, it takes a strip from the back of the head with the skin. For FUE, you still take from the back area as well. Is there a certain amount of follicles you have to make sure you get? How many do you usually collect or aim to get from back there?
Yes, it's the same area of the head, and the reason is, like we've talked before, is because those hair follicles in men are not susceptible to the hormone that is responsible for most of the hair loss in men. That's testosterone, dihydrotestosterone, DHT. Those hair follicles in the back are not sensitive to that hormone, and that's why we can move them from the back to whatever we need. As far as how many, that depends on what we're trying to achieve, what the patient wants, and what's available to. It depends. Everybody's different. Some people have more density than others. Some people don't need as much of a transplant. So we have to do it on a one by one.
A case-by-case
Case by case,
situation.
exactly.
And so as far as this procedure, is there any, just to clarify, is there any shaving that then has to be done when you come into this procedure to make sure it clears space or anything? Or no, do you look the same when you leave? How does that work out for people when they come in?
We do need to shave the area that the donor area, the back of the head. For the recipient area, we don't have to do it. I rather do it because it makes the procedure a little more efficient. But I've had patients that they really don't want to have their head completely shaved, so we can do that. We can just shave the donor area and then put the hairs in an area that is not shaved.
And as far as the donor area, does that usually look like a strip or the whole back of the head? Does that vary as well?
It varies. In men that wear their hair short, if they decide they don't want to have it completely shaved, we try to make it look nice, but they will have an area of the back of the head that is completely shaved. And for women, actually, it's easier. If they wear their hair long, we can just shave the area that we're going to use as a donor area, and then with the long hair, that can be covered. So for women, it's a lot easier to have a more natural result immediately.
It's a little more hidden. There's a little more we can do
Exactly.
with all
you
of
have
our
more
hair.
leeway with what you do
A
with
little
your
more
hair.
flexibility. And I know from that intro, we saw a lot of flexibility with crazy hairstyles from mohawks to
don't know how to
umbrella
call it.
arts. Oh my gosh, that looked like a competition of a hair in the beginning of our show. So let's get into a little bit of questions that we had coming in. My first one today is from Ralph from the West Palm area. He said when searching online, he was reading and researching that he would not be a good candidate because he has a heart disease and is diabetic, and wanted to know if that's true. And if so, what are things that you look for when looking at a patient's medical history as far as if they're a good candidate or not?
Sure. I mean, it depends on what kind of heart disease and how well controlled is the diabetes. Obviously, if it's somebody that has multiple medical problems that would put him at risk of or a high risk of infection or some kind of complications. If he has a heart problem and he's taking some kind of blood thinners, also if he's having some problems with breathing, the first part of the procedure, the patient is laying on their stomach for about 3 hours. So if it's somebody that is having problems breathing or problems keeping their blood pressure stable, it's probably not a good idea to have this procedure. And that's one of the things that I'm very careful about, is just make sure that the patients that have the procedure, it's safe, because at the end of the day, it is surgery.
It is a surgery. And for anyone who is listening or tuning in and wants to know where the Robotic Hair Institute is located, the Sierra Robotic Hair Institute, they're located at 2151 East Commercial Boulevard in Suite 204 over in Fort Lauderdale, Florida. So that is where you can find Dr. Rafael Sierra as well as his staff. They are there Monday through Friday, correct?
Yeah,
It's normal
and sometimes on
operation
weekends
hours?
too.
Sometimes weekends. So give them a call or check them out in person. They also have a website. You want to give out your website?
Sure, it's sierrarobotic.com.
.com, where you can read and find out more information on the different procedures that they offer, as well as information so that you can have a one-on-one consultation as well.
That's right.
Oh, we have another call-in question. Go ahead. Let's hear what you have.
Diabetics, in terms of healing, sometimes it's a problem. And I know you don't go deep into the roots here and implant. Can you just elaborate a little bit on the healing process for a diabetic?
Sure. Again, it depends on how well the diabetes is controlled. As long as the patient has a good control of the blood sugar, then it may affect a little bit of the healing, but as long as it's well controlled, it's not much of an issue.
Which is good to know. And for people who might be wondering, I know we reiterate this a lot on the show, but recovery time is, you see a natural regrowth for hair, and as far as recovery for after surgery, it is gradual, and pain tolerance is usually...
Sure. The recovery is of the procedure itself is very quick. Patients can go back to their normal activities within 24 to 48 hours. They just have to be careful with certain activities, like the way they shower, and make sure that they don't do a lot of really outdoor sports or direct sunlight. But for most part, people can go back to their normal lives within 48 hours. And as far as the growth rate, or when we see the final result of the procedure, that takes somewhere between 9 months and a year, because it's something that the hair follicles that we move, they have to kind of they go into shock, and then they have to recover, and then once they recover, which takes about 3-4 months, then they start producing hair again.
And May would like to know if she is someone who has currently gray hair and would like to do this transplant, would the hair grow back immediately as gray, or would she have her natural color, or how quick would it go back to the gray with her new hair?
It would grow back as gray.
It would grow back as
unfortunately.
gray.
Yeah,
So May,
I would like to find a way to make it grow different colors. That would be great. But
that would be
no.
pretty cool too. I would request some pinks and purples and fun rainbow colors. But May, that's because of how natural it is growing back. It is your hair, and this is hopefully a one-time procedure. So, but you can treat it as your natural hair, which means you could go right back to the hair salon if you were looking to get rid of all of those grays together,
Exactly.
right?
Yeah.
And we also have John from Gainesville. This question sounds a little fun. He wants to know if he only has hair growing from the back of his head. Sounds a little bit like a mullet situation going on. Would you be able to fix the baldness on the top of his head, since you said the donor area is from the back?
Correct. Yeah. So I guess what we have to see is how much he wants to cover. I don't know. We talked about the Norwood scale of hair loss. It goes from 1 to 7. When we're talking about a 7, it's when people have lost maybe more than 90% of the hair follicles at the top of the head.
And this is a scale 1 through 7, not 1 through 10. I would imagine 10 would be like complete baldness.
Well, there's 1A, 2A, 1B.
Okay, there's steps
2B.
in between.
Yeah. And it all has to do with the pattern and what the amount of hair loss. If somebody has lost a lot of hair, and usually the hair quality in the donor is not that great, then unfortunately that person is not a good candidate for a transplant.
So make sure if you are thinking even the slightest that you might be seeing signs of baldness or spots or feeling a little self-conscious or maybe just wanting some more hair, copious amounts of hair,
Copious amount
it
of
is
hair.
never too early to give Dr. Rafael Sierra a call. And if you would like to call into our show for any questions or concerns for Dr. Rafael Sierra, you can give us a call at 888-565-1470. Now, I still have some more questions, so don't go anywhere yet. We're going to take a quick commercial break, and we will be right back with Dr. Rafael Sierra. Stay tuned.
At Sierra Robotic Hair Institute, most patients notice incredible hair growth within a few months after their procedure. New hair growth may continue over the course of a year, with the most noticeable results usually seen 12 months after the procedure has been performed. The new hair growth can provide patients with natural, thicker hair and fuller results. Men and women who undergo our post-surgical hair restoration protocols often experience dramatic and significant improvement in hair density and volume that helps augment procedure results. Sierra Robotic Hair Institute has performed numerous hair restoration procedures, all with excellent success. If you have an interest in the latest, next-generation hair restoration and would like to learn more, please give us a call at 954-776-0830. Again, that's 954-776-0830.
And welcome back to Better Hair, Better You. I'm your host, Alana, sitting down with Dr. Rafael Sierra with the Robotic Hair Institute located in Fort Lauderdale, Florida. We were just talking about how far is too far when you have lost hair and to immediately come in and have a consultation to discuss if the FUE transplant is right for you. I also want to point out Valentine's Day is coming around the corner, so if you want to give a gift to yourself or someone you know or love, maybe we can
It's
even...
a great way to show love.
Oh, yes. I love you, but let's go get some more hair on top of your head. It'll make you feel great. I will say, whenever we have had discussions, even talking with previous patients, they talk about how their better hair has really made a better you and lifting up their self-confidence in the workplace, at home, how they view themselves, and it's a true pick-me-up feeling. So when thinking more along those lines, it truly is a more meaningful gift that can help change someone
for the rest of your life. So it's a
Yes.
long-lasting gift.
A one and done, long lasting gift that they won't forget and would be happy to receive. So I have some more questions coming in. One of which is, do you recommend PRP before, after, or both for the FUE transplant? We've discussed before that PRP is something that can help with hair growth, and maybe you can give a little recap on what PRP is, but what's the ideal timeline for doing both of them?
So it depends. Again, usually, so PRP is, let's start there. It's a concentrate of platelets. Stands for it means platelet-rich plasma. And what we do is we take a certain amount of blood from the patient, we put it in a centrifuge, we obtain a concentrate of platelets, which is a component of the blood, and that concentrate also has some molecules that are called growth factors and cytokines that help repair tissue. So when we inject that in different areas of the body, it's been used a lot for injuries in sports, for orthopedic purposes, and for hair specifically. There's a little bit of evidence, scientific evidence that it helps with hair growth. When to do it, I would say it's best as soon as you notice that there's some hair loss to slow down the hair loss. After the transplant, it does, theoretically, it helps also with the transplanted hair follicles to, get stronger faster.
So it gives it a little boost
Exactly.
to that recovery
We
time.
offer with a transplant, we offer a PRP treatment at 6 months after the transplant. And then after that, if the patient wants to continue with that treatment, we offer a 50% discount for the rest of their life.
Which is good to know. So you can come back for more if you think it has been helping you. And sounds also like it's truly up to the patient on what track would be best for them as well.
Yeah.
So I also have a question from Angela over in California, who says her dad wants to do the procedure, but the first time he had it done, he had some complications. And I think those complications was explained as a bad graft. She wants to know, would he be able to have this procedure done again, even though it was a failed try the first time? And also, would you be able to explain a little bit of what a bad graft would even be from that situation?
I'm not sure what they would be talking about. I'm not sure if it was a complication at the donor area or the recipient area. I don't know if the grafts didn't survive as much as they should have. So I would have to know a little more about what they're more specific about what they're talking about.
More of a case situation.
Yeah. As far as how many times, depending on each patient, but usually about 4 or 5 times in a lifetime, sometimes even 7, depending on how the donor area is. We can do it multiple times throughout somebody's life, but every time we have to reassess, make sure that there's enough hair follicles in the donor area, because the last thing we want to do is remove hair follicles from the donor area and turn that into a bald spot.
Into another bald spot.
Exactly.
That
So
would be
we have to
worst case scenario over here.
Yeah, so we have to be very careful with that.
So, Angela, it sounds like your best bet is to give Dr. Raphael a call.
Yeah.
Would you mind dropping in your phone number for best to reach you?
Call us at 954-776-0830.
And as always, whether you want to stop on in, give a call, or check out their website, a consultation is the best way to start to see if this procedure is right for you and to work with the best under Dr. Raphael Sierra's guidance, too. Now, an anonymous caller wants to know if he has a bald spot on his beard. He wants to know if you can still do the FUE type of procedure to help his beard grow back.
Yeah, definitely.
So it is possible.
It is possible. We do beard and eyebrow transplants.
Would it be more painful being that it's on your face? Is that a more sensitive area?
It is definitely more sensitive, but it's all done with local anesthetic. So it might be a little more sensitive at the time that we inject the local anesthetic, but once that's acting, there's no pain.
Now, my mind is wondering along the lines of, will it grow faster than the rest of the beard, though? Because if you're taking it from your hair, and my hair is going to grow faster than maybe your facial hair.
It is possible, yeah. It's the same thing with eyebrows. If we do a transplant of the eyebrows, that hair is going to grow like if it was hair from the head. So it just have to be very clear that needs to be trimmed. Otherwise, it's going to be a long.
I would also imagine you would have to do a color check as well. So, anonymous caller, if you are doing that, making sure that your beard is the same hair color as the hair on top of your head, because that could also be a little mismatched situation.
An issue, yeah.
Now, Maggie would like to know if you do the procedure and there's areas that need more work. And we've discussed this before that, the thickness, the amounts of copious hair someone wants can vary just because hair types are different for everybody. How long does someone have to wait to come back for a second time if they wanted to do it again?
I usually recommend that they wait at least 9 months, because by then we can see about 80% to 90% of the final result. So I try to encourage people to be patient and see what the result is of the first procedure, and then decide if they want another procedure.
Which is a good call. And if you're interested in seeing those before and after pictures, you can check out his website as well. Well, our time has really blown by
Already?
today. I know. We were hit with lots of questions for this week. And as always, you can send us more if you have them. This has been the Better Hair, Better You show with Dr. Rafael Sierra. Located in Fort Lauderdale, you can find his facility or give him a call or find his website. So for now, have a good rest of your night. Stay warm, and we will see you next week with Better Hair, Better You. Good night, everyone.
Good night.
You have been listening to the Better Hair, Better You show with Dr. Sierra. Dr. Sierra has shared valuable inspiration and information to help restore hair growth and confidence. If you want more information, call Dr. Sierra at 954-776-0830 or visit his website at sierrarobotic.com. And tune in again next week for another valuable life improvement moment.